should be able to go in 1, 2, 3. From predictive analytics to robotic surgery, AI is unlocking possibilities that were once the realm of science fiction. But with innovation comes with complexity. Ethical considerations, data governance, and the challenges of integrating cutting-edge technology into legacy systems. These are big challenges that we have to solve as health innovators. Hi, this is Pankaj Gupta from EthAum Partners, a zero-based revenue scaler and fund based in Singapore with approximately 120 global startups in our portfolio. Today, we are joined by a group of visionary leaders, technologists, and clinicians who are not only shaping the future of healthcare, but doing so with a deep sense of responsibility and purpose. Together, we will explore the breakthroughs, the barriers, and the bold ideas driving this revolution. Before diving into the insightful conversation, I would request our esteemed panelists to introduce themselves. If I may start with Justin. Justin, please go ahead and introduce yourself.
Right. Hi, my name is Justin. I'm from Gense Technologies, and we work on a portable AI health screening device that does things on liver, lungs, and quite a lot more. So thank you.
Thanks a lot, Justin. Justin is based in Hong Kong, and obviously he has a lot of insights about Hong Kong, China, and East Asia markets. So he's going to provide a lot of insights on how the telehealth and diagnostic space are evolving because of AI in these geographies. Now I would request Dr. Sofia to introduce herself. Dr. Sofia, please.
Hi, hello. I am Sofia. I'm a medical doctor from Italy, and I collaborate with an Italian platform of telehealth, telemedicine. And I also work in private clinics in Italy, but now I'm currently based in London because I'm about to end my master in global health management with a particular focus on innovation and entrepreneurship. So that's me.
Fantastic. Thanks a lot, Dr. Sofia. Appreciate your time today. And I'm sure that you're going to share a lot of insights about how the European healthcare system is evolving, the challenges that you're facing in Europe, and would love to learn about the innovations that you are seeing firsthand in Europe. Really appreciate your time today. Joalin, may I request you to introduce yourself, please?
Sure. Good evening, everyone. My name is Joalin Lim, and currently I'm the CEO and the founder of Agape Lion MedTech Healthcare Group. We served at least 330 companies from worldwide, entering the whole Asia Pacific regions, and in healthcare, digital healthcare products and IoT products, as well as MedTech products. So personally, I am a Singapore-born but overseas returned from the United States. I have a master and PhD in biomedical engineering with a minor in health informatics. So my first degree is in computer electrical engineering. So I'm definitely a big advocate for digital healthcare as well as AI in healthcare application.
Fantastic. Thanks a lot, Joalin. And I'm sure that we are going to get a lot of insights from you on how Southeast Asia healthcare ecosystem is evolving, especially with new technologies like AI and IoT. We have other panelists, Richard and Shekhar, and they will be joining in any time. But I would request Tony, VP Partnerships at Gense Technologies and moderator of today's panel, to introduce himself. Tony, please go ahead.
Sure. Hi, everyone. So my name is Tony. I do VP of Partnerships at Gense Technologies, a health tech startup here in Hong Kong. Really happy to moderate this session. I think we'll have some lots of really good insights. I have a background in nutritional biochemistry, so I both do a little business, a little bit of science, and I'm really looking forward to hearing about a lot of insights from all the panels here.
Fantastic. Thanks a lot, Tony. And I know that you prepared some really interesting questions, and I know that our panelists are already excited to answer those questions. So please, why don't we start with the very first question? Please go ahead.
Okay, let's do this. So, I think we'll start with a really generalized question, and the panelists can take it from wherever, however they want to take it. So this one might be for Joalin real quick, which is, what challenges do you currently see in the healthcare ecosystem, particularly what you've seen in Singapore and the ASEAN countries that you've seen?
That's a great question. I think this is a $6 million question if every one of us can solve these big issues about fragmented data rails across the care settings. What I meant is the NEHR, National Electronic Health Records. Can it be shared over within its own country, such as Singapore? We know that we have at least 3 hospital clusters. However, until now, we are still waiting for them to be able to start talking together, as well as within the public and the private hospitals. There is no patchy, but it's a more open line where the data are shared equally among between all these hospitals, whether it's private or public, so that the patient can be benefited from it. It's the same issues that I heard in the last couple of conferences that I attended. Malaysia is facing the same thing. Thailand is facing the same thing. In fact, Thailand is a bit more advancement to us because in their telemedicine health, they do have a universal coverage. And for us, we have a mixed system in Singapore. So it all depends on the hospitals and provider, the private clinics who provide telemedicine's capabilities. So I think it's important to have data sharing with kosher, meaning that there is a protection, there's an amount of data that is being predefined that is allowed to share among all the hospitals in order to reduce the repetition of tests or the looking for historic data. So is this in terms of intra-operation, it need to be improved.
Okay. And I'm going to ask the same question to you, Sofia. Is it somewhat similar in the UK and in Italy as far as this goes, or are there other challenges you see?
Basically, there is, yes, I would say that it's pretty similar both to the UK, in the UK and also Italy. There are although other challenges, for example, like I can also like stick to telemedicine, for example, because one of the main challenges, for example, is the access to healthcare, because ERs are always overcrowded, or also the GP, for example, in Italy works a bit differently because it has about 1,500 patients basically that he or she take care of. And basically, obviously, the access, even in this sense, is more complicated for patients. So, like when I think about a solution to that, I can think about telemedicine, obviously, which is the way that was created for like for rural places, and like people that can more easily access to healthcare, primary healthcare. And I mean, I can talk about telemedicine and AI, all the progress, but I don't know if anybody wants to add on that.
No, that's all very interesting. You know, we have the telemedicine approach, the data sharing approach, which is very regional. It sounds like here in the ASEAN countries. Justin, do you have any insights from your experience in Hong Kong as far as the current healthcare ecosystem and how it could be essentially improved, or what challenges you face?
Yeah, no, certainly. So one thing that when we're looking about this, and we're not just talking about right now and potentially maybe 5, 10 years down the road, we're talking a lot about AI integration, like Joalin has said, and then there's a lot of different medical data that we can integrate into. But if we look further ahead, it will have a diminishing return of how we can look at data. Because for now, we have a lot of interaction and the medical records that we can use. But compared to all of this, it won't be something that can be compared to a recent blood test or recent medical scanning. And that's what's quite a lot more valuable. So from what I see in here, in order to really get to the competitive edge, you do need a lot of next generation hardware to support that data collection systems. So we're seeing a lot of good movements in here. So, CGMs, we have, smaller and more longer periods that does not require finger pricks. We see Fitbit, Oura Ring making strides. We see, ECG machines that are being a lot more consumables. But we're looking at some really important, but still a relatively small scope of disease that we're looking at. So if we want to go beyond the next level, that there's only so much you can get from messaging, from videos and stuff like this. We're looking at a next wave of IoT devices that can collect a lot more data and then allow you to look at organ-specific diseases. And this also allows a lot more scalability as well, because to be honest, hospitals, doctors, nurses, it's not something that you can multiply 2-3-fold in 5 years' time. But primary care, things before and after hospital, there's a huge space that we can tap into with elderly care, with self-care, with home care. And we see this as a really exciting part, how we can enable this sort of hardware, get a lot more data, really creates a competitive edge for a lot of players in the clinical industry, whether it's from the hospital side for patient management, to clinic side for lead generation, engaging patients, to even elderly or self-care. This, I think, is a really, really interesting landscape that we're seeing a lot of interest and opportunity in as well.
No, I think that's great, and I think that's a really good segue to our next question, which is really about. I think you can maybe expand a little bit, Sofia, when you're regards to telemedicine approach, but in general, how can medtech AI innovations be somewhat transformative for healthcare from what you've seen?
Yes, I mean, from my direct experience, which obviously, I mean, I'm a telehealth doctor as well. I mean, more in general, I would say that we're moving towards, like, talking about chronic diseases, for example. I'm thinking about obesity or diabetes care. We're shifting gradually, thanks to AI, machine learning, NPL, just in general, from a more to more of a predictive like sort of management of the pathology, which I think it's basically crucial, because obviously like thanks to this predictive approach, then patients will need less and less time to spend with the physician. So obviously this will also benefit the healthcare system just in general, time-wise and access-wise. When I think about telemedicine, just in general, also the workflow is not necessarily lighter, but it's way faster, because, for example, we have before the consultation with the physician, we also have basically a screening, a first screening, collection of data, of symptoms from the patients. They basically answer all the questions from the questionnaire, and AI can basically not diagnose the patient, but maybe make a list of the most probable, the most likely pathology to the least likely. So once the doctor, the physician, actually video call the patient, they have a general picture of what's going on basically with the patient themselves. And yeah, so it's gonna be way quicker than just the normal consultation. Also, there are some more specific implication of AI, which can be like related to cardiology, to the cardiology sector, for example, or chronic disease just in general, and that's going to be a continual monitoring of the pathology. So again, especially with the chronic diseases. And
no, that's really good insight. I'm going to throw the same question to Justin here, in particular, because our company is technically in the medtech AI space. Does he see any, from his experience, how these AI innovations can be transformative for a healthcare perspective?
Yeah, no, absolutely. So I think one of the things that we can talk about is the general concept of personalization. So it's been around for a long time in healthcare. We're always talking about more precision medicine, but it's always been something that's only accessible with the really, really high-paying customers. with AI, with a lot of this sort of capabilities, we can move this a lot faster. And one thing that could be interesting to think about is how we would shift the key touch points inside healthcare, where it's always treatment based. You look at when you have serious disease, most of the touch points are about curing those, into a lot more on the front side, preventive screening, management of health into primary care.
Yeah.
So
I think
if
it
we
should be.
think,
Oh, sorry.
yeah. No,
I'm sorry, go
yeah,
ahead.
please.
No, please. This is an open
Yeah, no,
forum. Go ahead.
Okay. No, I was thinking that like personalization, like it's really, it's gonna be the next thing. And thanks to, again, machine learning, for example, also like wearable devices, there's gonna be an integration of all data. So everything will be truly personalized. And there are also, for example, in diabetes care, I don't remember now the name of the device, but there's basically a collection of data that can predict, based on what you ate and what all your parameters are, what your glucose level is going to be after 60 minutes, for example. So I think that if we focus on this kind of preventive medicine, which is going to be really heavily personalized, then like that will be the future. But I also think that we have to draw the line somewhere, because AI, I mean, it's still in development. So there's, for example, hallucination, like there are gonna be some mistakes. And like when we think about healthcare, health, and just in general, obviously we have to be extra careful. So there will be always at least a monitoring from a physician. Like somewhere there's gonna be a physician monitoring the whole situation.
Yeah, I jump in, Dr. Sofia. I kind of I totally agree with the personalized care concept, because in the past several years, a lot of medicines is very much focused on doctors, as they are like the god of making all the decisions on behalf of you of your health. But now I think the whole shift is that the healthcare should be self-care. It's a more personalized focus on the patient, should take care of itself. And I will see an innovative route of a home-based monitoring and preventive, let's say, for instance, a blood pressure cuff that is used to monitor hypertension patients. Some of them need to regularly go to GP office to have a checkup once every 2 weeks, or even once a week if you have very high blood pressure problems. But if the cuff can be transmit data with the AI help through the cloud and go all the way to the clinics of the doctors, and the AI software, it be able to help pre-warning the patients and say when you need to come in for a real life checkup or things like that, or your blood pressure is too high, you need to keep monitoring for the next couple of monitoring times, things like that, of preventive as a pre-warning for the patients through the data transfer into the cloud to the clinics or even hospitals. So the next question would be, innovative is good because it helps elderly patients to be able to stay at home and be able to continue have the healthcare without being physically need to transport to the clinics or hospitals. So that is a true plus, right? However, we need to think about the other questions, that when the clinics is providing this kind of services, then you get into the more into policy side. How do you ensure safety of the data, and how much data is going to store in where, who are going to use it, and then later how you're going to turn it into a national platform of sharing data among all your private patients from the private doctors versus the public patients from the public doctors. Yeah, that's something
that's a very interesting point as well. Like the data privacy or the policy side is always a big discussion. So it's a great thing to bring up. And it's always interesting that when we think about healthcare, we always think from the start, from the public sort of healthcare provider side, how we can, through preventive care, through better management, through better data sharing, help people manage health better. And then we can save a lot of costs. for the public side. And I think it's not a problem that we only talk about on the public side exclusively. There's also a lot to gain from the private side on personalization as well. So when you look at personalization, people are thinking about, okay, maybe if in a very cynical way, if you treat disease early, maybe you lose a bit of opportunity to do treatments. It's not big money for them, but in some ways, it could be really insightful for private operators in the clinic or hospital side as well. So I'll give you two examples. One would be with lead generation. So if you want to acquire new customers, if you want to get them into your service chain, it would be much easier, for example, if you give them a simple scan in the office at the home, and then they find out they have a certain liver disease problem. And then it would be much harder to ask them not to do follow-ups. You really gain their interest into doing those sort of early things that would get you into the ecosystem. And then personalization for a private sort of point of view, it creates stickiness as well. So it's something that we see a lot of healthcare providers struggling against. So increasing with this competitive world, we're looking at normally price and quality comparisons. But if you know your customers really well, it's a separate landscape that you can really compete on. If you create a lot of touch points and people come back all the time, you manage their health well, it creates a lot of trust. And with that trust, with all those data, it's really the stickiness that would bring about a lot more business opportunities. So it's one thing that we do see being really beneficial with those sort of ongoing touch points, unique insights, and with all those extra touch points, extra loyalty, extra trust that you have throughout this entire engagement with all the hardware. It's probably the defensive mode that you can claim against, just on top of the price and quality that as a private provider of healthcare could give out as well. So it could be a balanced thing that we see both on the public and private side.
I would also like to invite Kate Pound. She's on the call right now, and she shared some insights on the long-term plans that England set out for the next 10 years. So
Yeah.
Kate, would you like to unmute yourself and please share more about England's long-term plan?
So yes, hello, I'm Kate Pound, and I work in the NHS, in NHS England in the Emergency Care Improvement Support Team. And my background is I'm actually a nurse, still a qualified nurse. But in England, we're really looking at development of virtual care and moving from our emergency departments are overcrowded. It's very much a system under pressure. So the long-term goal is to look about how we can deliver healthcare closer to where patients are, and not coming into hospital, staying at home. And it's kind of like looking at prevention rather than treatment, if you know what I mean. We cannot deliver this without digital innovation. We have to have digital innovation. So currently we have systems called Hospital at Home, which is where we use the use of technology to help prevent people being in hospital. And then we also have the virtual care, which is really, this is where the real innovation is starting to get, where patients are being monitored. So in Birmingham, they took the top 500 patients that were at risk of being admitted to hospital over winter with COPD, which is chronic obstructive airways disease, and they used virtual monitoring to see if these patients were deteriorating. And because they were doing that, they were able to prevent them coming into hospital, because they were able to read the data, see what's happening, and act before the person got really ill. So, this is very much right up my street. This is where I get really excited about hearing where the use of AI and virtual care, where it can come together. And, I don't know if you guys have come across the report, is it Health Beyond? And that is Canadian Space Agency report, where they're looking at delivering of virtual care and how we can get this care to hard to reach communities. But actually this is about prototyping care for the future, when we kind of think about traveling to Mars or to the space. And this is where it might sound like it's starting about being small, but this is actually bigger than what it actually is. So exciting times. Okay.
No, I think thank you, Kate, for that information about, really looking at virtual care in the UK. Obviously, I think we've all sort of heard the headlines about some of the NHS system. I used to live there for about 3 years, and I could see that myself. But I think there's this idea that Joalin did bring up, which is, we want these kind of new technologies to come out to help, unburden some of that healthcare system. But there's certainly a lot of bottlenecks in place. And I think maybe, Joalin, you'd be a good person to really ask about what kinds of bottlenecks you think there are, since you do see the med tech space, you do see it's the actual healthcare space as well. Can you talk a little bit about that and some of those bottlenecks that you can really foresee that occur?
Yeah. I think first is the policy. So you want to think about AI transfer data from one point to the other, especially like involved in private information, PDPA in Singapore, HIPAA in the United States. These need to be set still as the policy standards where the whole country have to abide with. And that's maybe the chaoticness come in, because all the three different hospitals cluster might not be consistently agreeing with one set of policies. Because once you have the standards being defined, everybody will just base on these standards to build their own system. And the second of all, you have bottlenecks like hospitals using so various different systems in terms of electronic health records. Everybody just adopt different providers, and that also can these providers talk to each other. It complicated the technology perspective of having shared module that's compatible with each other. So I think this is basically two important things they need to sort it out before they can have a national electronic record that can share with all the physicians, where it's important for them to first take one step at a time. Yeah.
Also, I would like to add on that, for example, I have noticed that in Italy, talking about electronic health records, like they are deployed really unevenly just across regions. So there's not even like a good support system nationwide. So like before even thinking about the difference between the private and the public providers of healthcare, like if there's not even the public one that is working just cohesively nationwide, then I think that's a pinpoint that needs to be addressed as well.
Yeah, I agree with Dr. Sofia that we really need to have like the whole country Ministry of Health come out with a consistent policy sets of standards that everybody, whether you're private or public hospitals, they have to be all abiding and work from the same standards. That way, you will not you will lessen the chaos and you put the chaos at bay. At least you have a ground, a baseline to start with. Everybody are on the same page, or else everybody come from various different systems and various different modules. They are not able to cohesively communicate with each other in terms of even technical side. Yeah.
I would request Kate to jump in and share her insights.
Yeah, so I was going to say, one of the other things that we find really difficult, completely, we've got so many different EPRs, it's, it's just like you kind of have to find out before you go and do any work which EPR you have. But one of the real problems we have is that the hospitals don't actually necessarily own their data, because it's we can't access it, and that becomes a real issue when you're trying to do, try to be smart with what you've got, and you can't, because you have to pay companies to get access to your own data, which is just kind of like, it kind of blows my mind when you think about this situation that we get in. And I was just going to say, I mean, one of the things that gets really exciting is the hope. So we in NHS England, we have a digital AI team that actually that's their job, is looking at development of AI. And we've had to introduce, because typically what happens, you've got your early adopters, and you had people kind of like starting ambient scribing without actually the policies underneath it, or kind of like how we're going to manage to, patient data and all this. So they've brought in an ambient scribing guidance and policies now, so that's great. But we also have a AI community and ambassadors community, and we have about 5,000 people in it across across the country, which is, and they have monthly meetups, and it's a community in itself. So there's definitely the willingness and the excitement to do stuff. And I think it's just kind of like, as you say, it's those blockers that can sometimes feel like over, if you want to stop a project from going forward, you just have to talk about governance, and that's it. Everybody's kind of like, we can't possibly do it. Governance is just like, you might as well give up now. But sometimes it's used as an excuse, and rather than, people will just say, oh, it's governance, we can't do it because of governance, and then kind of go, well, why can't we do it? And sometimes
I think that's a very, very good point. But it's exciting to see in England where we have like 5,000 people just working on this, and I think one of the key ways to do this is to really just bring in governance people at the first step. Like we can try with them, we find out whatever's wrong, and then at the end of the day, I think we all want to make impact. We all want to make sure new stuff is being brought out, and I think dialogues like this are really important. Like we're trying to bring in a lot more advantage to the healthcare system, but there's a lot of stakeholders, and rightly so. They should be very concerned about what they're doing on their own scope as well. So this is certainly very, very interesting, and it's important for the public sector, private sector, just to have this sort of openness to try new stuff first, and then we co-pilot together and see how we can work things out.
Yeah, I think this all, just kind of sum up a lot of what we've talked about so far. I think a lot of the not necessarily misalignment, but misstep is that there is no real stakeholder alignment between, the people that actually need the service to the actual governance to implementation to regulation. It's all very complex web. And then how do we bring all these stakeholders together and kind of push a certain agenda if we want to be at that place in 5 or 10 years? And I guess this is a really good segue to really this kind of ideal situation. And I think, Joalin, you wanted to expand on this a little bit more, but let's say we throw away our kind of preconceived notions of what the healthcare system and healthcare is right now. But what kind of change can you see if you were to start over? And then we're going to keep it very general, very fun, because why not? We're on a Zoom here. And what kind of change would you say could really maximize or really benefit the current health system? And I know that's a huge thing, but let's talk ideas here. It's fun.
All right. So if I have a magic wand, I would like to see one patient to one electronic record and one set of data. I don't think you need to share a lot of your data in several different types or different hospitals. I think the patient should own their own data. And I think it would be future if everything, if it's just too complicated that the government are not involving in setting policy and governance, and the private hospitals or the public hospital administrator are not gathered together to do that. It could be turned around that all patients should own their own data, and they should keep their data in the vault and in the cloud. And so that when they go to different countries, if they are having any sicknesses, they should have a key to unlock that for whosoever they choose to release the data to help them in terms of healthcare. So that might be a one way to solve, so that all these few different types of hospital system doesn't fight against each other of who owns whose data. First of all, I don't understand why the hospital, when you go to have a test, they start claiming your data as theirs. So even some hospitals that I've come across, they start selling blinded healthcare data to other research institution or even company who doing research, right? So in other words, they own your patient's data. That means they own my data and own your data. Who give them the right? I think I feel better if my data are owned by myself, and then it will reduce the need of HIPAA compliant PDPA type of ugliness. And so that why not? We own everything of our body, right? We own our organs. Why don't we own our data? That's my magic wand.
No, I think that's all fair. Do you have any thoughts on this, Sophia, as far as this kind of, you've seen it from a doctor perspective,
I mean,
you're
yes, I
practicing.
was thinking about that. Yeah. I mean, I was actually focusing, like, do I agree? Do I not agree? I mean, obviously I agree because I'm kind of like, I don't really want to share all my data, like, especially if I don't have control over it. But like, if I look at the bigger picture, then I think that it could provide some insights for like future research that can help not only me, but like a lot of other people as well in my same condition. Like, I think that really, I mean, it's a bit of a difficult topic, I'd say. I mean, I cannot really choose a side on this one.
Yeah, I help you, Dr. Sofia, I help you. So maybe a person can own their data to up to certain year, the recent year, and the historic data can be placed in some hospital for them to use.
Thank you.
We can compromise. We can always compromise to make it work. Yeah, but the overall idea is that why can't we own our own data instead of, because I will not be able to see one cardiologist. I might want to end up seeing 3 cardiologists. I don't want 3 sets of testing. I don't want 3 sets of MRI.
Yes,
why can't I just have just one and then make 3 different doctors looking at one set of testing? So, and I can save time, it save healthcare costs, and then I should own my data, because if I have this I just say hypothetically, if a patient have a cardiovascular issues in Singapore, and when they want to travel overseas to Europe or even US or any other countries, they should be able to allow to share this information to the whichever the country they are at, the local cardiologist to help them, right? If anything emergency case. So
but I
think to a certain extent, it's quite important to own our own data.
Yes, I agree. I was just thinking, like, I think there's also like a bit of competitions maybe between physicians. So obviously, if you see different doctors, they're not gonna trust the previous one. They're gonna ask you to repeat like a lot of things. So that might be an issue, like with cutting costs with the NHS, because yes, I'm gonna share the data that I own to you, but if you're still gonna have doubt, that's not gonna, like, I'm still gonna do additional examinations or that. So that's a psychological factor.
No, I understand.
Which actually it happened to me just this year in April. I had kidney stones and I was visited by one doctor like to do an imaging examination, and everything was negative. I repeated one with a different doctor 2 days later, and the situation was completely different. So I mean, it's yes, but I see your point. Like, I agree.
Yeah. Even if you need to have another set of data done, but at least you're in control whose doctors, which tests you have done. You can always say, okay, Dr. A, you want me to redo the Dr. B information. Yeah, to one extent, you can always choose to go to another Dr. C.
Yeah, I agree.
Yeah, I think that's
like
fair.
It could be useful as well for like when you're traveling, like as you mentioned before, like just like when you go to a different country, still you have your own data that you can show the doctors. But in that case, it could be like they have different guidelines. So in that sense, I mean, it would be more difficult because you have to adapt to their healthcare systems and their rules, basically. So yeah, everything is really complicated in the healthcare system.
Just to jump in, please.
I was going to say, I was just going to say, I quite like the idea of owning my own data, having my own healthcare records, and we've talked about it a lot in England. I mean, normally we get things like, oh, people will lose their notes, they won't be able to be responsible and look after them, but that's absolute rubbish. So I don't know if it's like this in other countries, but in England, in the UK, if you're pregnant, you have your own maternity notes, and you take your maternity notes everywhere with you, and nobody ever loses them. So it's kind of an example. We always refer to this as an example. And I mean, we're getting more and more opportunities now to share. So, you know, the introduction of apps and all sorts of things. So currently we've got the NHS app where you can look on and see what your healthcare records are, what's been written in your case notes and things like that. So it is kind of getting better, but yeah, I would be on the side of having my own notes and taking care of myself, and being, you know, self-caring in that respect, and making my choices myself.
Yeah, I agree with you, Kate. And even if people will say that they can lose their data easily, no, it's not possible, because we can always have company that come up with the vaults to have all your data, save it in a common cloud, where they are assigned with a key to individual. And so there's always a lot of ways to safeguard your data.
Justin, what are your thoughts on this ideal La La Land to make healthcare ideal?
So I think those are really good points. We've talked about owning our own data, you know, how to secure data, how to integrate all those data, and I would think a bit on the flip side, just because we're in this, right? I'm a bit more greedy. I want a lot more data. So, you know, all of the data that we have, it's good. But if I could have, you know, a lot more understanding on my health all the time, longitudinal data, it will be a dream for researchers. It will be a dream for, you know, prevention, for management of health. And if we can get it really cheaply and on at home, in offices, in primary care settings, that would really be something that could change healthcare entirely. That answers a lot of questions about how do we solve the emergency room capacity issues. That would give it a lot more push to actually ask people to integrate data, because there's so much more that we can use. And then you know, with Dr. Sofia sharing as well, if we have a lot more of those, it's much easier to find people who are going through similar places that we're working on. So my dream would just be, you know, having a lot more data that we can simply access cheaply, easily, and comprehensively.
No, I think that's a really good segue to really wanting to. I think a lot of the audience wants to hone in on what actually happens in these particular settings. Either Dr. Sofia or Kate, can you like expound a little bit about the primary healthcare situation in the UK specifically, on what you've seen? Again, maybe some of the challenges, but maybe also some things that you can see on the horizon that can really sort of alleviate what, you know, we consider this hospital burden.
Yeah, I mean, I can think about like seeing, for example, a GP, like it takes forever. Like, I think it's mostly about waiting times, and also, especially because there's a GP shortage in the UK currently. So, yeah, I would say that's really a really big problem. And like, I was thinking also about telemedicine. Like, I think that could solve the problem as well. Like, because I mean, it's a virtual consultation, waiting times are obviously not gonna be there. And like, when you see a physician through telemedicine, the physician can determine like what type of care you need. So yeah, I mean, I don't know if you can get like my point.
I was going to say, so for me, my point would be that we need to be smart with what we've got, and you know, that to me is kind of like vital. So there is an IT system now where it's not adopted across the whole country, but only certain practices have taken it. And I think more, it needs to be, you know, wider accessible, and that is it's the patient has to kind of put in their details into a IT system, and it's kind of triaging, and because they can triage, it means that you know, one of my colleagues who's a GP, so if you need an appointment today, you can have an appointment today and you don't wait. And it's because they're able to go through, and there's an awful lot of waste, you know, because, you know, it can be just a simple thing. Getting a prescription can take, if without the right systems in place, can be long. can be difficult. And then because people can't get the prescription, they use a GP appointment to get an emergency prescription. And then it's like, well, if you just had the process right, you wouldn't need that. So I think the opportunities are really about being really smart with what we've got. And we talk a lot in the NHS about productivity. I don't really like that word because I think it kind of removes the human factor, humans out of the actual delivery. And so for me, that would be the big thing, is actually we need to be really smart with what we've got, and be playful and try new ways of delivering. So that'd be my thing. And we've got to be smarter because we want to deliver healthcare closer to home, and being in hospital is not a safe place. The risk of deconditioning and getting hospital-acquired infections is greater. So we've got to be working with that ambition to delivering care closer to home.
No, I think those are really great insights. Here in Hong Kong, we obviously, one of the initiatives here is the primary healthcare blueprint. I think over in Singapore, we also have the Healthier SG. So, I think these kind of, there's a lot of implementation. Any thoughts, Joalin or Justin, about what it looks like in your respective regions?
So the reason why I'm such a big advocate of patients or individuals, civilians, to own their own clinical healthcare data. One of other questions is a very big example for you. A few years ago, we all have to go through the COVID disaster or COVID pandemic, right? Everybody experienced that, and it robbed away 10 million people's life in the whole world. That is based on the reference of Worldometer. So if you own your data, don't you think it's good that if you can actually show the doctor whether under your condition can you take the certain type of vaccine? I give you this question to think about it. Wouldn't that make a lot more sense that people are using their own data to predict with this vaccine, does it have a high risk or low risk or something like that? So anyway, that's just some thoughts.
We also have Ki Chuan on the call from Singapore Medical Association, and he has some interesting insights. He shared them on the chat. But Ki, would you like to unmute yourself and share your insights over the call? So his point is that while we are forced to upload data to National Electronic Health Record, NEHR, in Singapore, there are controls in place for patients to restrict access to healthcare professionals. So slightly different opinion, but pretty insightful, I guess. Keith, please feel free to unmute yourself whenever you want. Let's continue, Tony. Yeah.
Yeah, did you want to chip in, Justin?
Yeah. I could answer better from the Hong Kong's perspective as well, because we're on the topic of primary care, right? And it's taken them us a while to digest this problem. But what we're seeing is quite interesting in Hong Kong is that there's an emerging trend. We're seeing a lot of hospital staff are trying to build up local capacity at community levels. So one of the main goals of public healthcare is to reduce the burden of the overloading in all of the sectors, right? And we're seeing a trend that they really want to train up local NGOs, charities, community centers, community clinics to help them manage their health better. And we're seeing a lot more trends, like when we have partnerships with them, using technology to enable a lot more, number-based, quantifiable monitoring. Something that's really easy to understand and interpret. And with those systems, because of AI, because we have a much better communication, not all of those information has to be interpreted by doctors as well. People generally, from a really simple perspective, understand BMI. But going a bit deeper with blood pressure, you understand your own blood glucose as well. But it could go deeper with all the risk factors. With what we do in FedLive, with a lot of stuff that we can look how to prevent things from going into fibrosis, cirrhosis, or even cancer. From COPD, like we have with Kate mentioned as well, it's always a really big topic, how we can manage people's health and alert the healthcare providers when there's potential deterioration. All of those are interesting capacity building points that I think technology and hardware could enable alongside AI as well. So this is one emerging trend that we see in Hong Kong.
I was thinking about like there's also the other side of the coin about owning our own data, like especially when you're not like you're not working in a healthcare environment, like because obviously when you have a deep understanding of how health, medicine, whatever work, then you can be like you are informed like in the right way. But there are some patients that are not maybe too informed, they're just paranoid about their health. So I think that could also complicate like even primary care, for example. They could start to look too deep into some details that are actually like seeing from a physician, like for example, a physician can see some data. This data can be just normal, for example, in a certain condition or just a certain setting, but maybe like instead of cutting times for example, a GP, this patient can actually be really persistent and like petulant, I'd say, maybe with the physician. So like I think it also depends on whose hands this data are in. Like generalization, I mean, that would be great, but also there are some psychiatrist conditions also that could be considered in this case, in this sense.
I was just going to say, through lockdown, obviously lots of people had to change what they were doing and how they worked. And there was a team of rheumatologists in Bristol that started to use an app to communicate with their patients, and they were able to do things such as so they had blood tests. The doctors in the hospital were able to see the blood tests and communicate and say, oh, you need to increase your medicines, I'll sort that out. And so the patient didn't have to go in for appointments, and they say, you know, you don't need to come in for an appointment, your bloods are fine, or you do need to come in. And I think that it really highlights the change of society as well, in the fact that, you know, traditionally in medicine, it would be like, well, I do what the doctor tells me to do. And now patients want to be part of their own healthcare. They want to be part and being part of the discussion. You know, we've moved from that we're consumers to citizens. We want to be working together. And I think this is where some of the important elements we need to consider as we move forward, that, you know, society is changing. People want to be part of it. They don't want to be, you know, be totally consumers.
No, thanks for that, Kate. And I think that's a perfect transition to sort of maybe one final topic. And I think it actually goes along with what you, Kate, said and what Joalin said about, you know, there were a lot of obviously new technologies in place because of COVID, right? Whether it's how do we do this, and obviously we've had a boom of technological advances because of, say, tragedy and what so forth. But, you know, in kind of non-tragic times, let's just put it that way, do you see like certain roadblocks to, we want AI in some capacity. We want to be able to keep your data or share your data in some capacity. We want telemedicine in some capacity, but what exactly are the roadblocks that prevent a lot of these things from happening? Please, anyone that chimes in, if they have a perspective on really what hinders medtech adoption do you see nowadays?
I think one thing that we could use a bit more, it's more of those sort of a sandbox safe environment that you can test, you know, low risk AI integration. So healthcare inherently, understandably, would be very conservative, but at the same time, there's a lot to gain from if you do use the system well. So one thing that we encourage all the time is for public sector, you know, lead the way to some of the innovation adoption. You don't have to use it in all your system right away, but, you know, try some of it and see how it works, and then tell the solution providers how do they provide a better solution that the governance people would be happy with, the people who would be benefiting from this would have better usage from. But forensic sector, I think it's something similar as well. There's generally a lot more stakeholders that need to be on board with this. So if there's a general openness to try new things, see how we could improve upon those so that you can become a leader in those spaces, I think those would be really helpful as well to solve all these bottlenecks.
I do
What are your
have
perspectives, Joalin?
Yeah, I think cost. None of us have mentioned this big word called cost. In healthcare, in today's world, the costs keep raising as our living standards get higher. And AI seems to give people an implication of expensive. Surgical robots with AI software tends to perceive as expensive. Actually, they need to do a lot of health health assessment type of clinical trial, to health economic clinical trial, to prove that these surgical advancement of innovative surgical robotic system with AI software can be higher precisions in their surgical application. And on top of that, it's cost saving. So I think
it's not, I would, it's not always cost saving, actually. Like even like a procedure can also be more expensive, but as long as it's under the NICE.
Dr. Sofia, let me finish first. Yeah. So yes, surgical, that's why I say surgical robots with AI software tends to have a perception that is expensive. However, if you prove that your healthcare cost is lower, meaning that if it's expensive procedure but a shorter OR time, it will reduce your number of hours in the OR. In the long term, you are actually saving cost. So there's all this health economics that need to be done properly, because AI itself always have an implication and have a perception that people think that, oh, there's AI in that, must be expensive, because they think it's an advanced software. Actually, it's not. So cost, how to educate a general public to adopt AI software, anything or IoT with AI system, AI software in that, and still be able to educate the patients or general publics or preventive medicine that you can get effective data without addition of big cost. That is something, a challenge, because that's what you guys were talking about, bottleneck. I think is the general public understanding of anything with the IoT, with the AI, or even any MedTech device with the AI does not always produce high cost, but rather it's more efficiency and cost effectiveness. Yeah.
No, I think that's really well said. Do you have any more to add, Dr. Sofia, just about like whether cost reductions, medtech adoption that you see in the UK? I know certainly budget is a real big issue, of course.
Yes. I mean, not really to like, as like it was mentioned, like it has to be cost effective. The goal is not always like cost saving. Like that's the thing, especially in the long term, because some procedures that maybe in the short term can be like even more costly for the NHS, then in the long term can bring like to really substantial reductions. Yeah, which is why like health economics, like a really good team is really like important when with the health technology assessment. So yeah, I just wanted to like comment that. Yeah, sorry for interrupting before.
No, that's fine. That's fine. Do you have anything else to add, Kate?
Yeah, I was just going to say, I think one of the blockers can be people's beliefs about people's abilities. You know, they're like, oh, they'll never want to use that. You know, we talk about Silver Surfers, and actually, you know, all right, it might not work for everybody, but just by saying that nobody wants to use it is absolute, you know, I mean, the rubbish, and we just need to just have a go. And if it doesn't work for that person, then that's fine. Let's look at another way we can support them. But it's often used as a generalized phrase that people won't want to use it. And, and it's like the same phrase of you're safest in hospital, the belief of that. And it's like, no, that's not the case. And so it's kind of, just not allowing that to be a blocker. Okay.
Yeah, no, I think I even personally agree with that. It's myself. There's perception, there's reality, and the idea is that really we are moving in a more digital AI world. Now it's like, how do we live within that realm, right? And how do we, as we grow older, how do we start adopting things with caution, but also just with an openness? I think every generation gets new technologies, and it's really about what actually works for society. And there have been big failures. We've seen this before, but you don't really succeed unless you fail a little bit, and it becomes a learning opportunity. I think with that, I really want to thank the panelists here for coming on the call and really discussing, some very wide-ranging topics. I think I'll throw it to Pankaj for the next follow-up.
Thank you. Thanks a lot, Tony. I think you have been a fantastic moderator. You were able to extract insights from the leaders. And I can see that, all the panelists are really excited about, sharing their insights. And that's why we could see a really good engagement and a very insightful conversation. I'm sure we could have continued with this conversation for more time, but now we will have to move on to the next segment of the event, which is called roast session. And you may be wondering why we call it roast session. The reason is most of the time startup founders are not able to get a brutal, honest feedback from the industry leaders. They get some sugar-coated BS, which doesn't really help them understand, hey, what are the challenges with my solution or scalability plans or defensibility or differentiation? And that's why we host these roast sessions where founders are able to present their product and get some really brutal, honest feedback from the leaders. So here we have Justin, again, founding CEO of Gense. He's going to talk about what they are building, their solution scalability, and then we'll take it from there. Yeah. So
right. Thank you.
Justin, please go ahead.
So I'll just share some really brief slides that we have. I'll just speak for around 5 minutes so that we can allow more time for more fluid discussion. So at Gense, we're offering a portable health screening device. So it's been produced, it's in market, we're in several countries now. And essentially we do two things. We're working on preventive screening and chronic disease monitoring. So by far most popular scans is in liver. We've also been asked to work with hospitals on lungs, and then there's also kidney capabilities as well. So how it works is really simple. So we have on the top left side a palm-sized device that connects to the middle belt. We wear around the body parts that we want to scan. So it's normally around your waist. And with that, it connects to an app. That apps both let you do testing, and then we also generate results basically in real time. So it's simple indicators that you don't really have to interpret. It's just low, medium, high risk, and where do you fall in terms of that number under that risk. And then there's a report so telling you all those sort of follow-ups and what those mean as well. So essentially, a bit of background, we invested by Alibaba. We work with the Hong Kong government quite a lot to roll this out there of shareholders as well. We've been involved in quite a few competitions. We also work with quite a lot of academic partners. So in Hong Kong, we work with 10+ professors in clinical trials engineering. And we also work with professors in US in the Europe side of friends, where they also help us validate locally with their own population, their own data, and a different sort of new technology development in conjunction as well. So it's quite simple. So on the left side, you put on a belt. This is for liver on this level. So for lungs a bit higher, kidney a bit lower. You don't really need anyone experienced to do it. So you don't need a nurse, a doctor, general social workers, even home by yourself, helping some other people would be doable as well. So if you do the test on the middle, it's around 1 minute. So if we do a fat liver test, for example, it's 39 seconds. And after that, it basically generates a report out within 20 seconds. So what we do is we do a lot of those sort of mass screening days, where in single device and single morning, we could do 30 to 50 people. So if we have multiple devices going on, it could be a lot more. And because we do research really simply as well with just numbers, it's explainable by a lot of people, so they can adapt it to a lot of things. It could be used for health management. It could be used for, upselling different services on follow-up testing, nutritional, exercise, lifestyle changes. And obviously, it could be a really good public tool to manage health as well. So it's been used quite widely in, for example, elderly services and other places as well. So obviously, we've published. So one of the key things of trustworthy IoT in medical is you do need a good backing. So we've published in Nature Scientific reports, CHEST, IEEE, quite a lot of different places. We have our own patents. And on compliance side, we've got RP 45, 60601, those sort of medical electronic safety and quality management systems that allow us to really go into different markets from this year onwards. So we've started working with countries in ASEAN, in South Asia, like Indonesia, India. We've started our footprint in the Middle East as well. We have governments in the South America, Latin America side approaching us for, mass management of health related to diabetes and sort of liver diseases. So all of those are something that we have ongoing. So a bit about select clients, for example, in Hong Kong. With NGOs, we work with home care. We work with sort of screening days. We work with daycare centers just to help them build up capacity locally. Obviously, it will be in conjunction sometimes with public health institutions so that we build local capacity through those community institutions as well. So clinics will work with some of the biggest in the region where they look at this to generate leads, for example. It's a very easy way to go and provide corporate services. They can screen a lot of people. They provide home care services as well. And then it's also a really good engagement tool where you look at people's health every 2-3 months, because it's not realistic to do a full body scan every quarter, right? But with some targeted improvements, you can do this a lot more often. And obviously with our public sector, we work with post-hospital, pre-hospital management just to keep people from deteriorating enough to go into hospital. At the same time, if they do get some disease and they get discharged, we want to help them monitor sort of the post-discharge management so that they don't have to go back very often as well. And that's sort of where we're at in Hong Kong. And elsewhere in Asia, we've started working with a more home care side of things where they don't just do blood tests at home. They can bring out the device to the home as well and work with a lot of follow-up programs, clinics, upgrades, just to do a lot more services and engage a lot more frequently. So those are some of the things that we have been ongoingly pursuing. And obviously, we're still looking for a lot of partnerships, both in the deployment side, and we're developing a lot more capabilities other than just on liver or lung side. There are things that we're looking at heart failure on sort of research level. So those are the things that we're really open to working with everyone on this as well. So yeah, thank you very much on this.
Thanks a lot, Justin, for the quick presentation. And I would request panelists to ask questions and provide feedback as well. So if I may start with Dr. Sofia, would you like to ask any question, or Joalin, any questions from your side for Justin?
Yeah, I was thinking, like, it seems like very innovative, like it has a lot of potential. So it's not really a roast, like from my side. Yeah, like you say, like, is there an app as well? You said like that it's connected, so everything is showing on the app, basically.
Yeah, no. And thank you for the compliment. So it is. We have to make it really simple to use. So we don't want it to be locked against really trained personnel. Because when you look at ultrasound, it claims nurses can use it, but you realistically need a sonographer. We want to make it a lot more easy with a lower entry barrier. So the app lets you just follow step by step. It's basically something that's similar to your everyday consumer app, you pick it up the first time, if you have digital literacy, you should have been able to operate most of it. And then it's not just about the test, it's about the result as well. We make it as simple to understand as possible. And then we give you really simple guidelines. So for example, if you want to manage fatty liver, what sort of diet has been scientifically proven to help you? What are some sort of good key points that you can look at in terms of intake, in terms of things that you should avoid? And we also scientifically talk about how do you increase metabolism so that you can avoid the duration of those diseases as well. So that's one of the key aspects of fatty liver. So we talk about how do we do resistance exercise, cardio exercises in conjunction, so that it's a balanced thing that you can manage your metabolic health a lot better. So this is the way we want to design the app. It's out, it's being used quite well, I think. And it's all about UX and simplicity to understand.
Okay, yeah. Okay, I'm gonna think about some questions. Like I'm
Sure, of
still.
Sure, Dr. Sofia. Joalin, anything from your side? Any question from your side? So, Dr. Sofia, if I have to get some insights from you on the solution, I mean, obviously, Justin and team are working hard in Asia market at the moment, right? Hong Kong, especially. From the applicability perspective, feasibility perspective, how the European market may behave. For example, Italy or UK, how these markets may behave with this kind of product. What do you think?
I think it really depends, like even on the region, like the part of the country that we're thinking about. I mean, there is gonna like I'm seeing that about innovation, like from the patient perspective, they're still kind of slow into like adopting like a new technology, a new innovation in the healthcare ecosystem. So, but like I think that maybe in the next few years, when it's gonna just become the normal, like that's gonna be the option, like maybe the main option, then they're gonna be open to even like a broader list range of innovations. So I think that in the UK, maybe this is gonna work better than Italy, for example. But also, like we have to think about the age, for example, of the patients. Like obviously, as you said, it has to be somebody with technology literacy, otherwise they would not be able to actually use it. It has to be, but still, I think that it should be like the language itself. It should be like really simple, like because even if you're able, like it's gonna explain things in a very simple way in order to be adopted. Otherwise, it's not. I don't think that's gonna work. Like there's always gonna be like a physician like mediating between the app, like the device, and what it's saying anyway. So yeah, I think that's like a crucial thing. But yeah, I mean, I really I really enjoy the idea. I think it's really innovative, and yeah, like it has potential, like maybe in the future to be even like developed even more, to get even more information, like maybe. But I mean, it's like a really good start. Yes.
No, thank you. Yeah, we look forward to continue this offline and see how we could exchange more insights from you as well.
Thank you, Dr. Sofia. Justin, there's another question in my personal chat, and the question is around what kind of regulatory requirements do you have to meet to really scale? Can you please share some insight on that?
So it obviously depends on the local regions and the usage of the device. So with what we have now, the ISO 13485, that system allows us to get into a lot of what we so-called the developing countries. And that could be converted into hospital clinical settings relatively easily with some of the local partners. So obviously the couple of big ones, US, we do need a FDA if we were going to a medical system. But there's also a sort of a consumer aspect that we are gaining a lot of interest on as well. So this is something that other than just the B2B side, it could be something that can be developed into home care. And then not just about liver health. It's something that we can look at as sort of general metabolic diseases and other things that we can develop into sort of a more consumable device. We also have been working quite closely with the NMPA in China. So those will be out in hopefully not too long a timeline. And European countries typically would be CE-MDR, which we're going through against. So one of the good things about 1345 is that we can also closely sort of convert it into something called MDSAP. So across several countries that we can enter into Australia, Canada. So those are sort of relatively short pathway as well. So all of those partnerships are sort of a medium short-term horizons, and we can go into, if not already right now, that we're going into countries that we've mentioned we're working in the Asia side and the Middle East side.
Thanks a lot, Justin. Appreciate that.
Thank you.
Any criticism or guidance to Justin that, hey, this is how you may be thinking about your go-to-market strategy or your channel strategy or your product strategy? And I'm sure that he will take criticism very, very positively. So anything on those lines?
Are you thinking, so like when you want to launch the product to the market, are you thinking about like launching to customers directly, or like maybe to, I don't know, physicians to recommend the use of it?
So we normally do a what we call B2B channel. So we work with clinics, we work with hospitals, we work with elderly services. And generally to introduce this, it's easier if we share the device, and let it be by usage for customers. So you can rely on, like you said, some professionals, semi-professionals, to interpret some of the results for you. You make sure the operation is all right. And then when we start gaining a lot of trust and a lot of sort of support, know-how in the system, then it can slowly convert into more of a B2C side of things where the consumer could have some access to this. But primarily, we're working with clinics, hospitals mostly.
Okay. And are you also sharing the data with them? Like all the data that it collects, like where are they going? Are you keeping them or?
So the data we keep that we can have access to are all de-identified. So we have our own, basically a black box that will fit data into that we don't have patient data, only that sort of scan data. And then it goes into that storage system where it's partitioned with each of the sort of hospitals or clinics that we work with. None of those are transferable in between those because the patient haven't consented the other institution to have the data. But because the patient it's consented with the hospital, whatever accessing data, the hospital would have access to it as well, and they have the full patient list tracking the historic data with all the device. Obviously, patient with that have access to their own data as well. But ultimately, like you said, it's a data owned by patients. So even though hospital can access it, if patient requests to delete it, they have to as well. But ultimately, they both have access if nothing's really special happening.
Okay. And like when you came up with the idea, like were you thinking about a problem to solve, and like the problem was being like set by patients, or like was just your idea and you decided to pursue that? Like, do you think there's an actual need that you heard from patients, or like it's something that you think might work just
So
because
obviously,
you thought about that?
it's sort of a mix as well. It's always an iterative process. We see something that could work, and then we have a lot of requests about we want to make healthcare a lot more accessible in the sense that you have more data that you can get to. You have different people, private sector want more business, public sector want less business, and we sort of tune it against that. So what we have, it's a very, very simple, very cost-effective way to test things, time efficient as well. And then we basically follow what they want to make sure the adoption of that product suits the use case. So how it's being used in the public sector, in private sector, in elderly services, it's a very, very different angle. And basically the deployment of those, it's based on those sort of advices. And I know we were really open as well. So I imagine if we go into the UK, we need that entire conversation started all over again, just to see how we can best work with that. But overall, I think people are not against a really easy to use, cost-effective device, just to get a lot more data and a lot more frequently as well. So with that framework, we start from there and see how does it best fit into whatever objective the stakeholder might have. And we try to align all people on this.
Okay, is the app like a free, does it have premium features? Like, is it a freemium, like, does it have free features and then you can pay to have some additional like features on the app, or is it just you buy the device, there's the app, and you can use like everything?
So right now, yes, the second model is
Okay,
what we're currently operating
okay.
now. And we have offered quite a lot of free upgrades to whoever is working with us now.
Okay.
Imagine in a lot more capabilities when we have a lot more accessories. Some of those will be locked by accessory because we need a different type of detection. But right now we're trying to grow with the community and then just open access to new features that we're offering.
Okay. Okay. Yeah, do you think that, like, yeah, so exactly, maybe in the future you can also like collaborate, like, for example, with some other firms that produce wearables devices, and like you can connect it to those. I do think so.
Yeah. We're
Like, for
always open to
example, Apple
integration.
Watch, and yeah, okay, perfect. Yeah. That's
Absolutely,
good.
absolutely.
Yeah.
Because some of the things that we're looking at are dual modality stuff. Because when you look at the heart, it's always you get a lot more data out if you work in conjunction with ECG, just to
Yes, of course.
look at the data that you're looking at. It's similar to how you work with MRI as well. So combining a lot of data would have multiplier effects.
Yes. Okay, that's really nice.
Yeah, no, thank you.
Thanks a lot, Dr. Sofia. I think the feedback that you offered is quite meaningful, quite valuable. And again, thanks for this insightful conversation. And I'm sure that we will have more opportunities to reconnect and see how we can, explore synergies, collaborate with each other. Thanks a lot, Dr. Swapnil, for joining in and listening patiently. If you have any other questions or comments, please feel free to reach out to us separately. Similarly, Kay, I know that you're with kids right now, so you could not speak and ask your questions, but would love to respond to your questions separately. So yeah, and Joalin, Snehal, thanks everybody for dialing in today. It has been fantastic conversation. Thanks again, Tony, for moderating such a great panel. And Justin, I think what you're doing, what you're building is extremely innovative, extremely transformative. Now the question is, how do we scale it, right? And I think this is where experts like Dr. Sofia, Joalin, Key would support with their insights on the product roadmap, on the go-to-market strategies, on regulatory aspects, and so on and so forth. So thanks everybody for your time today. Really appreciate it. And would love to reconnect again and see how we can partner together. Yeah. Thank you.
Great.
Thank you very much.
Thank you.
Thank you.
Thank you guys. Take care. Stay safe. Bye.
Thank you.